Good afternoon. Thank you. And thank you for joining us here at the Korea Society. My name is Stephen Norper. I'm the Senior Director here at the Korea Society. And we're delighted to have friends here for an intimate conversation. We thought when the issue of trauma care in North Korea was presented to us that this is the right kind of program to have here because it's an issue that we here at the Korea Society in my decade have not broached. And we are very interested in this issue of healthcare in North Korea. One, we're concerned about the peoples of North Korea and what they suffer in terms of additional risks, which will be presented by both Kees and Ramon in their description. And also potentially the opportunities of South Korea as one of the region's leading global healthcare providers to, at some point, through integration and unification, help provide for that need for the North Korean people. But to help us along the way are really two eminent individuals. One is Kees Pak, who is a doctor associated with Harvard University's program, and we're very delighted to have him here to talk from the perspective of a medical professional, and of course Ramon Pacheco Pardo, who is an eminent voice from Europe, out of both Brussels and London, and his work is quite notable in terms of what he has done from Brussels in particular, and his forthcoming book on Korea, North Korea, United States relations. And I highly recommend that you check out his Twitter feed as well as his publications. I'd like to thank those here from UNDPPA, Sonia Bachman and Sam Martel, Clara as well, because they have provided so much wonderful support in terms of the Korea Society's outreach and understanding on North Korea. And also Ambassador Susan Elliott from the National Committee on American Foreign Policy, who graces us with her presence tonight. So thank you, and welcome. Great to have you both here, and great to hear of your new study, which we're keen to hear the results of, because this is really a fairly new area for most outside observers, and for those of us streaming live, and for those listening via podcast or watching by YouTube video, perhaps a new subject, which is trauma care in North Korea. Kees, did you want to start us off?
I can. First, let me say thank you, Steve, and the Korea Society for hosting us. This is fantastic. So I'm a surgeon by training. I've been working in North Korea since 2007. I've been there about 20 times. So let me just walk you through my journey, and then how we came to this report, and then give you some of the key messages. So I work in the operating rooms with North Korean surgeons. They're superb. I enjoy working with them, working across the OR table, fighting the common enemy, right? Injuries and diseases. It's a very trust-building type of exercise. So over the years, and Dr. Hong, I just want to acknowledge he's here. David Hong is also a neurosurgeon from Stanford, and he's one of my partners when we go to North Korea. Over the years, we've been working there on the ground with North Korean doctors. Over the last 3 or 4 years, I've had the chance to shift from working on the ground to now, as well as working on the ground, to more of a public health view. So I work at Harvard Medical School in the Global Health Department, and they provide technical assistance to WHO in Geneva. So let me tell you what that assistance looks like. We provide help to the ministries of health as they scale up surgical services throughout the whole country. So it's a very high level type of work. So I was delighted to hear in 2015 there was a resolution at the World Health Assembly. It's an annual thing hosted by the World Health Organization, and 194 members of the World Health Organization come together, and they set priorities for the next year or next few years. In 2015, there was a resolution calling for strengthening emergency and essential surgical care at the frontline hospitals. This is what we call surgery resolution. It was a big event for people who work in global health and surgery in particular. Well, this resolution was sponsored by Zambia, but it was co-sponsored by USA. At the same time, DPR Korea spoke on behalf of all the Southeast Asia region of WHO in support of this resolution. This is a rare case where US and North Korea have come together and they're in agreement, strengthening surgical services. So that was in 2015. 2016, DPR Korea Ministry of Public Health publishes their 5-year strategic plan. They put into the plan the provision of WHO package of essential surgical services at the frontline hospitals, exactly what they're supposed to do from the resolution. So then I was delighted. This is going to be great because I'm working on the ground at these teaching hospitals with surgeons. This is going to be a great way to expand surgical services. Nothing has happened. And this is now 2019. Something interesting has happened this year. We've been hearing from the WHO country office in Pyongyang that the Ministry of Public Health is now prioritized strengthening surgical services for the country. So they want to move ahead with it. Most recently, I met with the DPRK delegation at the World Health Assembly last month. And their question is, we really want to do this, but how is this possible? And you know why? Because of the international sanctions, the funding cuts, it's a daunting task. A project of this magnitude, a national project to scale up surgical services, would cost about $500 million, based on using Tanzania and Zambia as a benchmark. It requires infrastructure, upgrading, equipment purchases, training of surgeons, nurses, and anesthesiologists. It's a massive project. So why do we do this report? We had an opportunity to partner with Ramon because there's a public health component of it, but there's the political component of it. And I really want to shift the discussion to the politics of the political determinant of health in North Korea in relation to surgical care. So we did this report to highlight the unmet surgical needs in North Korea. And we didn't want to talk about surgery because who wants to talk about surgery all the time? But we chose a condition, injuries in particular, because it's the largest burden for unmet surgical need at the district level hospitals. So what do we find on this report? Some of you may already know, children under 5 in North Korea, number one cause for death is infections, diarrhea, and pneumonia. But once you clear that age of 5 to all the way up to 29, injuries is the number one killer of this population. And the more concerning, this number is increasing over the last 15 years. And we know from all the increase in road traffic, so the mechanism for injuries, number one, the most of it is from road traffic injuries and occupational injuries. And you've seen stories about buildings collapsing, tourist buses crashing, and the capacity for treatment for this is quite limited in North Korea. So there's a burden, and then it's unmet. And then we did an interesting analysis. What is the economic cost of the injuries that we see in North Korea? And using just the kind of public health calculations called disability adjusted life years, we estimate $1.5 billion. This is how much North Korea loses annually as a result of their injuries, deaths from injuries and disabilities from injuries. And we did something interesting. We looked at the Myanmar, what happened in Myanmar when they opened up, right? The increasing tourism, traffic, and all that. And we estimate 50% increase in these numbers, the number of deaths as well as the economic cost, perhaps as much as $2.2 billion. So you can imagine in a country that the GDP ranges from 17 to 40 billion, we're not really sure where, but it's still a massive amount of economic losses. Notwithstanding the deaths and disability, but there's also a compelling reason to invest in it. But even though the DPR Korea Ministry of Health wants to proceed with this massive project, typically a country of this income level will get assistance from external donors, and then there's the sanction that it has to be overcome. And so that second half of the report is really about how can we overcome the political barriers. So I'll transition to my political scientist partner, Ramon.
Thank you, Kees. Ramon.
Yeah, thanks for the invitation as well. So basically what we do in the second part of the report, the last part, we actually say can this program be implemented now, so without sanctions relief, and should we be implementing it? Now, when it comes to the can, we actually say, well, if you look at the sanctions regime currently in place from the United Nations and from different countries, including the United States, there's a clear exemption for these type of projects, right? For everything that is related to humanitarian aid, this is exempted. So it shouldn't be an issue. We say it shouldn't be an issue because, as you probably know, many NGOs in recent months have been actually cutting down programs or even leaving North Korea because they are a little bit scared that because of their operation in North Korea, they might fall within the sanctions regime even without knowing so, right? So one of the things we want to do with the report is to highlight that if you look at the resolutions, this can actually be implemented. We have done as Kees has been indicated, we have done all the research about why this is important, that they should be implemented from a humanitarian perspective. But we go beyond the humanitarian perspective, and we also look at why politically it might be wise for the US, for other countries, to work together with North Korea to implement this program, and we found out different reasons why this would be the case. One of the reasons is because we're talking about co-financing. So this is not giving money to North Korea to implement the program, because there's always the concern that maybe North Korea might be diverting any funding that it receives and it goes towards its nuclear program, for example. But there are examples from Gavi, for example, the Global Vaccine Alliance, of implementing programs in North Korea in which there is a co-financing model. North Korea pays up to 50% of the cost of the program. Sometimes it pays less, 10%, depends on the program, depends on the year. But the important thing about this is that it shows the commitment of North Korea to dealing with this issue. So it is committed because it's putting its own money. We're not talking about in-kind contributions. We're actually talking about financial contributions that go to this program. B, because there's a partnership, so you are partnering with the institutions, the international organizations that are implementing this program. So from a political point of view, actually, we have been discussing this. The monitoring that would come with a program of this magnitude, so we're talking maybe about $500 million it could be, this would mean better monitoring, more monitors within North Korean territory. So we'll be talking actually about increasing the accountability of the North Korean government and the outside world knowing better where, for example, the aid is going, not only these programs, but other programs that might be implemented at the same time. There's another component as well, which is the concern, well, is this only going to help the elites in Pyongyang? And actually the program, the idea would be for it to be implemented across the whole country and at the same time. So you wouldn't start in Pyongyang and then move to the provinces, and let's say the North Korean regime might say, well, after it has been implemented in Pyongyang, we have no interest in the provinces. The idea would be to implement it in different places across the country at the same time. Because one of the things we did with the report, we did a small survey of former residents of North Korea and current residents of North Korea. And for example, in the provinces, the access to emergency care is far poorer than it is in the capital, actually, in Pyongyang, right? So we are helping out ordinary North Koreans that live across the whole country. And on the question of why should we be implementing it at this point, we have the humanitarian component that was mentioned, right? This is the biggest killer for North Koreans between the ages of 5 and 29. So even if we leave aside the issue of the economic cost that we do cover in the report, we're talking about families, people who are suffering losses, right, or even losing their life because of this issue. So there's this component. But there's also another component that we find interesting, which is if there is an opening up process in North Korea, right, if the country continues to open up, hence the comparison with Myanmar, then it is very likely that we will see more international projects, more international workers moving to North Korea for a period of time, as happens in any other developing country, an increase in tourism as well. And obviously, if North Korea gets a reputation as a place where if you have an accident, you might be losing a leg, for example, you might be losing an arm, or you might be killed because of the accident, because the trauma care capacity is not there yet, then this is going to make it less likely for foreigners to want to go into North Korea, for example, and support the economic growth of the country. So we start actually the first paragraph in the report. We refer to the accident that took place last year when a bus full of Chinese tourists crashed. And I think it was 50 of the tourists actually passed away, right? Because there was no emergency care to take care of them, right? And actually Kim Jong-un went to see those that were injured in the hospital because it was a tragedy. But also from a PR perspective, from a North Korean perspective, it was very negative. And there is one last component, I guess, that we mentioned in the report as well that is relevant. Which is the fact, if we're going to be implementing this program with North Korea at this point, this can actually help with trust building. The issue of trust was mentioned towards the beginning of your remarks, and this is one of the important issues that we have seen policymakers have been raising, right? We want to increase trust with North Korea. There's a lack of trust, not only between the US and North Korea, but in Europe, for example, there's also a lack of trust in North Korea, and this can actually help to address this issue, because we'll be implementing a program together, right, international community with North Korea, and this would be a sustainable program. So it wouldn't be it wouldn't be affected, or it shouldn't be affected by whatever is happening with the nuclear program and the missile program. This is a program that can be implemented over time, right? And it should be, the implementation should continue regardless of what is happening in the geopolitical issues that the outside the international community has with North Korea.
Wonderful. I'm wondering if we could tackle the question a little bit more about international assistance and where we are right now in terms of some of the impasse in humanitarian assistance, especially by way of access, and how you might see potential roles for American healthcare. And I know, Key, your good work out of Harvard has probably secured a lot of good U.S. support, and I know I've met at least one of your fellows who's gone to Pyongyang and done surgery there. But also the role for South Korea, again, given its great strategic advantage in healthcare, and what that might mean as time goes on, especially by way of the impulse for integration and unification and meeting the needs of the North Korean people.
So let me tackle the question of where we are with funding for humanitarian assistance. Due to a lot of the geopolitical events and political pressure, diplomatic pressure, traditional donors for North Korea's humanitarian assistance have pretty much gone away. Malaysia has stopped giving any money. UK has stopped giving money. New Zealand stopped giving any money. How does that impact the overall UN's programming of their humanitarian assistance? One example from last year, the UN publishes each year a list of urgent humanitarian needs and priorities, and it tells you exactly what they plan to do and how much money they need to do this activity. They asked for $111 million to provide services, urgent services to 6 million people. Of the 111 million, about 24 million was actually collected to allow programming. This is not enough. This is clearly majority of the population that are targeted for clean water, nutrition, food, basic medical needs aren't getting reached, and then that's really unacceptable. So that's where we are with the funding situation. Maybe you can talk about
the South Korea component,
yeah.
Because yes, we have been discussing this, right? If the program were to be accepted and implemented, we do think most of the funding ultimately will come from South Korea, not necessarily from the central government in South Korea. So, for example, the Seoul government has shown interest, right, in this type of programs. Obviously, there are NGOs. We have been talking to universities in South Korea as well. They have interest in providing assistance for this type of programs, and sometimes it's in-kind assistance, but they're also talking about financing as well. But what we think is important is that not all the funding is actually coming from South Korea, that there's an international coalition. And this doesn't necessarily mean that all countries are going to contribute huge amounts. I mean, it might be that a country in Southeast Asia might say, well, we can actually give 1 million or $500,000. Some country in Northern Europe, for example, that are very keen And this type of programs, they might say, well, we're willing to provide medical equipment. Like countries such as Germany, for example, has been doing this as part of its foreign aid. They provide medical equipment from German companies. So we could build this coalition, and yes, probably there would be a partner, probably South Korea, that will provide most of the funding. But by having an international coalition, you have this buy-in from the international community. But also for those that have concerns about the behavior of the North Korean government, well, the North Korean government would know that if, for example, it stops implementing the program, it is not failing South Korea or the US. It is actually failing the international community. And it goes back to the point about trust, right? If you want this trust building process, this sustainable engagement process, the more partners you have, the more we think this will be implemented over a longer period of time. And the North Korean government will have this buy-in that some people doubt it would have, but we think it has actually.
Mm-hmm. If I could ask you a little bit about the marketization effect. We had sort of a part one to this last week in terms of a discussion on marketization in North Korea, which is available at koreasociety.org on podcast. But how do you see sort of the issue of marketization in medical care? And how do you see the other dynamics in terms of politics, affluence, and accountability on the part of the North Korean regime? And if there is truly a desire for economic modernization, how to convince them that this is indeed in their national interest and the interest of the North Korean peoples to come to the fore and to listen to recommendations in reports like yours.
Mm-hmm. I'll start with the market component. When we did the survey, something interesting we found out is that access to medicines is not always adequate in North Korea, right? And quite a few of the respondents, they actually told us they would actually buy the medicines in the markets, for example. So this actually tells you the role that markets play not only in the everyday life of the North Korean people, but also at the place when they have an emergency and they actually need to tender for their loved ones, for example, and they need to help their family. But this actually also made us think that this type of program, because the marketization process that we have been talking about, and we have some pictures that we show in the report, also means that there is buildings, for example, the number of buildings is increasing across the whole country, right? We're talking about tourism facilities, but also talking about apartments, for example, being built in different places that are sold in a semi-market, right? We cannot call it a free market like we would have in other places, but it's a proto-market, maybe, if you want to call it that way. So people are getting used to this, and it seems that access to medical care, but you can talk much more about this than me, is also being somehow marketized, for example, as we see in the access to medicines, right? So it is part of the process of marketization. The project that we have in mind, we wouldn't say they're supporting the process of marketization, but it wouldn't be embedded on the process of marketization that is taking place in North Korea.
Yeah, so compared to some of its peer countries, if you will, like Cambodia, Cambodia has a very significant private medical market, which is out of pocket. So what happens in a privatized or a hybrid privatized and public health system, the rich and the haves get the better health care and the poor get the worse health care. North Korea actually has in its constitution guaranteed free health services for all of its people. So it's one of the, from a social protection standpoint and from a legal framework, it's very solid. The problem is their resources are quite limited. They do spend a lot of money on prevention, so they have one of the highest vaccination rates in the world, 97, 98% for children. And they do that in conjunction with Gavi, which provides vaccines at a discount. So they have a good public health system. Something like surgical care, I highly doubt that there could be a market that's created because of the infrastructural needs, things where drugs, certain types of, maybe minor procedures could be done privately. But when we're talking about scaling up these 40, there's a package of 44 essential surgical services. It could only be done in a hospital setting. Highly doubt that North Korea is going to allow a private system at this point. Sure. It may happen in the future, but yeah.
Sure. Yeah. Interesting. And my last question to you before we turn to our audience here is the reception of your report. I know yesterday you had the opportunity in Washington, D.C. To discuss this at the Korea Economic Institute of America. The Wall Street Journal did a very nice piece on the release of the study and the issue you described. But how do you feel in terms of the traction that you're establishing, and how would you invite our audience and those listening and watching to think about ways forward on these issues?
I might start with Europe, actually, because we do have, as you said, the launch event yesterday in Washington. We have the event today. But for example, in Europe, we're planning a number of launch events in different places, like Paris, where we have the OECD, Brussels, obviously the European institutions, and Geneva, right? We have the World Health Organization. And there is interest, not necessarily on the report only, but on this type of issues in Europe, right? There's interest in the humanitarian component of engagement with North Korea. There's this perception that maybe we focus too heavily on sanctions over the past 2 years or year and a half, 2017, 2018, right, until mid-2018, until we had the Singapore summit at least. There was this strong focus on sanctions in Europe. Some of the member states, especially the big three, the UK, France, and Germany, they were focusing on implementation of sanctions, and they were going across the world on this. To ensure that other countries will implement sanctions, but there has been a transformation over the past few months, and much more interest on, okay, well, maybe we went too extreme in the implementation of sanctions, and there was a humanitarian impact, and this has been reported widely, and we have to start looking at this type of issues. So that's quite interesting that we have found easy to get traction in terms of organizing events to present the report. Publicly, but also privately, so at both levels. So this hasn't happened yet. It will happen after the summer, because in Europe in the summer everyone is gone for holidays for 2 months, basically. But the interest is definitely there, and the interest from governments, so who ultimately actually can open the purse and start to fund these programs is certainly there.
So let's be frank. The critical actor here is the U.S., right? They hold overwhelming economic, political, and diplomatic power. And without their support and buy-in, this is going nowhere. Having said that, we did have meetings with the State Department about this report, and it was actually surprisingly well received. We're not sure how far it's going to get. But some of the reasons we think this program, this project, why U.S. should support or even partner in a project, this is a DPR Korea-led project, really. It's not a Dr. Pacheco and Key Park project, right? And we're just trying to raise the issue. It's a North Korea Ministry of Public Health-led health project. And why should U.S. care? And I think there's 4 main reasons. Well, maybe 5. First of all, they've already agreed on the principles, right? The resolution was passed in 2015. But from a strategic standpoint and how it aligns with the U.S. interest and values, the Singapore declaration, the first part has to do with transformation of the relationship between U.S. and DPR Korea. What better way is there to partner with DPR Korea to help treat their patients together, right? I mean, this is a win-win for me. The second is, with these hiccups, I think Ramon talked about it, with, things don't work out, there's a little bit of a cold and chill. But if you have an ongoing partnership in this multi-year project, it's sustained. It keeps the communication channels open. And then third, U.S. values. We care about the ordinary people, right? This is exactly what this project is designed to do. It's to improve surgical care at the district hospital levels. And then lastly, we always worry about, will these things get diverted? What happens with things when we send over there? With a massive project like this, if we are doing it in a cooperative fashion with multi-stakeholders, we would absolutely strengthen the UN agency's ability to monitor projects inside North Korea. So in many ways, I think there's advantages, and I hope that we move in that direction.
So thank you both. It's been a really rich hour, and Key and Ramon, thank you. We know that you'll be meeting with some of the professionals here in the audience after. We did want to give an opportunity for people to come up and say hello to you at the conclusion of the program. And I'd also like to thank a lot of familiar faces here in the audience tonight for their kind support through our spring policy season. This is technically our last program for the spring, and we look forward to welcoming you back in the fall for a very rich series of programs that will touch issues of North Korean nuclear missile concerns, issues of human rights, issues of the negotiations toward denuclearization, humanitarian affairs, and U.S.-Korea relations. For those of you keen on what's happening in the news cycle now relative to China and North Korea meetings, please do see our social media input at koreasociety.org for the latest updates. And we look forward to welcoming you back. For membership, as well as other information, please see us at koreasociety.org. And I did want to offer a special thanks in conclusion to Jonathan, to Peter in our sound booth, and to Ari for their kind efforts here tonight. So a round of applause for them. And please, a round of applause, please, for Key Park and for Ramon Pacheco Pardo. And do look for Ramon's book as soon as it's out. Thank you all, and see us at koreasociety.org.